Open your eyes. Around you, there is the world. Our world. Our world made of moments. Of dreams. Of stories. The stories that make up our lives. Stories that can explode with a sunrise, or smolder in the fleeting glance between two lovers before their hands touch. Stories born of that first look of recognition between a mother and a child. Or in the moments when, though separated by continents, our eyes meet across oceans and we are drawn back together as one. These are the stories of discovery, of triumph, of fear, of exhilaration and inspiration, of the impossible, and the laughter and tears that belong to us all. How many glittering moments for our eyes to behold. Our kaleidoscope of living things, of life. These are the stories we need our eyes to see. These are the stories we will help you tell. Your fuller life stories. Open your eyes. Let your story begin.
As eye science and technologies become more advanced and more affordable, the range of treatment options available to British families is ever expanding. Opticians regularly partner with specialist providers of ophthalmic services like Optegra Eye Healthcare to bring innovative technologies and specialist capabilities to the high street optician and their patients. Louisa Preston reports.
Optegra has the largest network of dedicated eye hospitals in the country and prides itself on its specialist knowledge and facilities, but also works very closely with opticians and GPs to provide the best possible service to patients. One of those patients is Dr. Philip Milne. He decided to use Optegra after finding out he had cataracts. He then discovered he was suitable for refractive cataract surgery with advanced technology lenses, meaning he could get rid of his glasses altogether.
I chose Optegra because it's dedicated to eye surgery. It had a very quick turnaround and it seemed the right place. Being able to thread a fly now and to be able to fish long into the evening, long past my friends, and still see what's going on has been quite amazing.
If I can ask you to pop your chin on there, the whole commitment at Optegra is eyes. And that means that we can practice medicine to the highest possible standard. Along with the quality of staff we've got and the quality of the equipment, it's really unparalleled in what we can offer patients. Behind the cornea lies the coloured bit of the eye, known as the iris. We are unique as a company in that we provide our surgeons and our patients with clinical outcomes. It's a very difficult thing to do because it involves a lot of data collection and a lot of data analysis. But unless we do that, we can't continually improve on our excellence.
Optegra prides itself on the research it does to make sure it provides patients with the best possible solutions for their needs by using the latest technology in eye care.
We really aim to deliver the A to Z of eyes. We need to have a consistent and systematic focus on keeping up to date and making sure that we do that really important job well for patients. Optegra Eye Sciences are really focused on innovation, and part of that is the opportunity for us to be involved in research projects, to really understand the latest technologies, emerging technologies. So we have research projects that may be looking at the latest diagnostic techniques, or surgical techniques, or some of the new lenses that are available in the market, so that we can trial and test and really help to bring the field forward.
Optegra consistently collaborates with opticians and GPs, offering them training and educational events.
We work actually quite closely with Optegra. We have done for a number of years. We refer a lot of our patients for analysis by their ophthalmologists for procedures like cataracts and macular degeneration and glaucoma. We get great feedback about Optegra, and one of the main things that we get feedback about is the length of time it takes for patients to be seen, and how quickly Optegra respond to our referrals. The nature of referral doesn't matter, they will get back to our patients very, very quickly. That puts my mind at rest and also gives patients peace of mind. We work very closely with them also by attending their educational programs. It's also great for networking as well, because there are a lot of optometrists from the area that visit these training sessions.
It's important for patients to know that they are accessing the best, because their eyes are the most important asset that they have. The relationship between the consultant and the opticians is extremely important, because it ensures there's continuity of care throughout that patient's entire journey.
I was bicycling across Westminster Bridge. As I looked out, not only what was near me was in focus, but the whole view was in focus, and it was like going from a 1955 sort of colour movie at the cinema to high definition IMAX.
I realised that I wasn't seeing as well as I usually did. There would be furry bits that blocked my vision totally. There were spots on the page that would block letters and words out. My life was getting more and more difficult, so I went to see the optometrist that I usually see. He put the screen up on the wall and he said, "Read it." And I said to him, "I can't see a thing." He got a bit of a shock and made an appointment for me to go to Optegra. I was taken through to see the specialist, and he said to me, "Mrs. Blackwell, I have to tell you, you've got macular degeneration." And I said, "What's that?" The specialist surgeon is so supportive. Knowing that there was something that I had that could be remedied, I was so grateful to him. I asked if I could give him a hug. I felt very comfortable and well looked after. It's all done so beautifully. Since I've started having the treatment, I can see so much better now and can do my hobbies without any problem at all. The worry's been taken away. Definitely changed my life, because the way I was going, by now I would have been blind. So I'm terribly grateful for them, and that's why I'm here. To say thank you. I am. I'm so grateful to them. I wouldn't hesitate to recommend Optegra to anybody.
With my job, I wake up in a new place every single day. I'm an opera singer. I sing classical opera on stages all over the world. I was nearsighted. I couldn't see about 4 feet from my eyes. Everything was a blur. I had headaches a lot. I want to be completely in the moment performing. I missed that interaction with the orchestra, and I just really wanted to be aware constantly of what people were thinking. I was a bit apprehensive beforehand. When I went to Optegra, there was a sense of trust that happened from that first visit. This surgery has absolutely changed my life. I love being able to step out on stage and see everything and take it all in. That first performance, when I was able to see the first violinist, have that connection, it's just wonderful. I love the feeling of being able to take risks and make every performance different, because that's what makes a live performance really special. I think that's what life's about, is seeing every aspect of something. I recommend Optegra to anybody who ever asks me.
I'm a documentary cameraman. I've been doing it now for over 30 years and I still love it. As a cameraman, I see more than most people see. I look differently at things. The eyes are incredibly important. When I was diagnosed with cataracts, I was very worried. Coming up to Salisbury Plain when I was walking the dogs, I couldn't really see the distance. Even with glasses on, I couldn't get it crisp. I like it to be crisp because that's what we're supposed to do with our camera work. You're getting older, when things start to pack up, they pack up. But here was somebody saying to me, we can get those changed. I found the whole procedure very reassuring. I never worried for a moment. Every nurse I saw, every surgeon, every receptionist, they were 100%, and that gave me confidence. I said, great, let's go for it. If I can get that clear again, if I can see that mast on the hill 10 miles away, I want to see it. The treatment I had was life-changing. I never believed I would see as clearly as I did after the operation. I went out and it was a magic day on Salisbury Plain. The light was beautiful and it was like a plane I hadn't been on before. I was seeing things I hadn't seen, colours I hadn't seen. I was given eyes that were 25 years younger, and that's a gift I never thought I would ever receive. A real eureka moment in my life. I would recommend Optegra because I trust them completely.
I'm a high-performance coach and mentor. I specialise in enhancing Olympic world-class athletes. People read books. I love reading maps. A map tells you so much. It's a great story to it. I love the escapism, being out there with the elements, it challenging me physically and mentally. It really gives you a true perspective on life. That's what I live for. Losing quality vision had a massive impact on me. I kind of got a small bit of depression over it really, I think, because my life is about being out there in the environment. I was so surprised that I thought this is all going to come to an end. I didn't feel safe. I was really worried, like anyone would be. This is my eyes. This is my business, my life, my hobbies. I wanted to know that I was definitely in the right hands, and I was confident enough to believe in Optegra, and the outcome for me was phenomenal. I don't ever take for granted where I'm at with my eyes now. Just to stop, to pull a map out and have the clarity that I had was just incredible. I'm doing things I was doing when I was in my 20s, and I'm 56 now, so it's definitely life-changing. We go away up in the mountains and stop, listen to the quiet and just enjoy that moment. There's something that comes out of that that's quite hard to talk about until you feel that as a family. It's what makes me want to get out of bed in the morning. You've got to make sure you see the right people.